Lower back pain is one of the most common problems I see, and also one of the most misunderstood. In my practice, I see very different profiles. Athletes pushing their bodies, people working long hours sitting, and others doing physically demanding work every day. But the complaint is often the same: pain that keeps coming back. In most cases, lower back pain has two main origins, either from the pelvis or from the lumbar spine. You may have a subluxation, a restriction in mobility of one or more vertebrae, which irritates nearby nerves, or disc-related problems, inflammation, swelling, or in more severe cases, a herniated disc compressing the nerve. This can lead to sciatica, pain radiating down the leg. Sometimes the problem is muscular, like piriformis syndrome, compressing the sciatic nerve, or higher lumbar irritation, causing pain in the groin or front of the leg. There can also be structural variations like spondylolisthesis or differences in the number of vertebrae. I remember one patient, he had severe lumbar episodes several times a year, and he couldn't sit for more than 15 minutes. Even driving became impossible. After following our full treatment protocol, his symptoms disappeared, and he returned to a completely normal life. At Wellnespirit, we don't just treat the pain. We correct the vertebrae, restore disc function, and reduce inflammation with targeted laser therapy. What can take years, we often resolve in a few sessions. Even if you've had this pain for years, there is a solution.
I'll help you understand your condition and guide you to the right treatment.
Book your session online in Andorra or Belgium.